Hi, my name is Camille, and this is Amy, and this is our project on multiple sclerosis, the case study report. So our case overview is that we have a client named Krista. She's a 66-year-old female with relapsing-remitting multiple sclerosis with an EDSS score of 1.0, which pretty much means that she has minimal symptoms, walks unaided, she has muscle weakness, and a little bit of balancing issues. With the pre-screening shows that we don't need any medical clearance because she shows no signs of cardiovascular disease. She does engage in regular physical activity, such as walking and bowling twice a week. Her On the assessment side, her best score had 16 errors, which was broadly normal for her age bracket, and her grip strength was 25 kilograms, which puts her in the 50th percentile for her age. However, dorsiflexion for her on her right and left feet were 11 degrees and 10 degrees, and her plantar flexion was 46 degrees and 43 degrees, which pretty much means that she had limited range of motion in her ankle, which could cause issues with gait. In comparison, now let's look at the ACSM guidelines that are on the picture, which does show what she's supposed to be at for her age bracket.
So our priorities are to improve her lower body strength and balance. Additional assessments that would be beneficial are the single leg stance test, which assesses static balance and ankle stability, and the sit to stand test, which is dynamic balance and lower body strength. We want to use RPE for intensity because fatigue is a common symptom of MS. She's taking Ubago medication, which has side effects of joint pain and muscle soreness, which can affect her exercise. And she often has, or she can have poor thermoregulation. So we want to exercise at cooler temperatures, such as early in the morning, when she also has less fatigue.
So now going into our review of literature, our first article was the Mogasti et al. So the purpose of this article was to test the effects of total body exercise resistance exercises by using a TRX with mobility, proprioception, and isometric lower body strength of patients with MS. The intervention of this article was 8 TRX whole body workouts for 8 weeks, and they performed these exercises 3 days a week and progressed every 2 weeks. The sessions were 30 minutes at 5 reps and 3 sets, and those increased every other session. Some example exercises that they used were squats, hip abductions, hamstring curls, and a quadruped stance. The results of this article showed that the TRX intervention significantly improved the performance of the sit to stand test, as well as the maximal contraction of knee flexors and extensors for the training group. So the application to our case to the article that they also had females that were similar to Krista's age with relapsing remitting sclerosis as well. And they also had a similar EDSS score, which the article used patients with an EDSS score of 4 and below, and Krista was a 1. So the strengths of this article was that they had a detailed TRX program progression was appropriate, but their weaknesses was they lacked a follow-up examination with their patients. So now we're going to compare the NSCA guidelines to the article methodology. So NSCA guidelines wants to have a progression as reduce reps and increase sets with a heavier load. However, the article progressed by using increased reps and sets with an intensity of increased difficulty, which is different because increased difficulty doesn't necessarily mean heavier loads. But the similarities were that they both did 3 times a week exercises with light to moderate intensity and had an overall selection of 8 to 10 exercises.
The purpose of Vetroska et al. Was to determine the effects of an online Pilates intervention on MS symptoms in women. Their intervention was 12 weeks long. They they did the exercises 2 days per week for 12 to 16 reps per exercise. Some examples are in the photos to the right. In the table below, we see the results. They had significant improvements in the sit to stand test. There was no change in the single leg stance test results, but the participants had higher perceived balance performance. Some strengths were that these were beginner-friendly positions for older adults. They worked on core training, which helps with balance. However, it lacked a control and it lacked reliable data on adherence. Oh, and the guidelines were similar in that it fit the rep range and the frequency per week.
So our last review of literature article was the Guillermo et al. Case, and the purpose of this article was to test the feasibility and the effects of 2 different 40-week structured physical exercise intervention groups based on fatigue, strength, and balance of people with MS. The intervention was that they had two different exercise groups. One was a supervised HIIT group, and the other one was a self-applied home-based exercise group. And they performed 12 to 15 reps of each exercise for 2 sets to start, which then progressed to 10 reps of 4 to 5 sets, and they used a resistance band as well. The results of the combination group had a significant improvement in the results of the sit to stand test from the baseline to then 20 weeks period. The application to our case and this article was that they used interval training with a resistance band, which is a feasible program without any negative side effects because using a resistance band has takes off the weight of the joints of the body. So the strengths of this article was that they used RPE for intensity and they progressed the reps and sets, which aligned with ACSM and NSCA guidelines. However, the weaknesses of this article, they had different reps and sets for the both intervention groups and did not specify specific exercises. The differences between the guidelines and the study intervention is that the study implemented high frequency six times per week and the duration was 90 minutes. They also implied high intensity, which was well tolerated if it was applied progressively, and also it could be individualized.
So to sum it up, it is valuable to consider multi-joint exercises, supplemented with single joint exercises that target all major muscle groups. It's good to start with body weight and banded exercises. We see improvements in a short amount of time, as little as 8 weeks for lower body strength. And it's valuable to involve core training. So for Krista, we can have simple equipment and it's effective at home.
So now we're going to go into our exercise program that we would provide for Krista. So our first exercise that we would like to include is our TRX squat and a banded squat. By using the TRX, to beginning, it also takes a lot of the load off of her joints. Using the squat exercise as the first one is because it's a multi-joint exercise. It strengthens the lower extremities. It improves hip mobility, and it will also improve the sit to stand test results because in a squat, when you're at the bottom of that squat, it is like sitting in a chair, and when you explode up from that squat, it is like standing up from that chair as well. So that second exercise that we selected was the farmer's carry and the suitcase carry. These are both anti-lateral flexion movements and will help with overall core stability and will help with load and ambulation. So this is a good example of this is when Krista has to bowl. She has to hold the bowling ball in one hand and then she has to walk down the lane. So this pretty much stimulates that in an exercise program. So the last exercise for this little area would be a banded kneeling row and our dumbbell row. This improves posture. And with Krista, this will also increase her thoracic mobility, which in the long run will improve her balance and gait since it will help with her forward leaning. And this exercise will also improve core stability.
Next, we'll do good mornings and progress to banded good mornings. This exercise targets the glutes and the hamstrings, which are important because strengthening these will improve her gait. It's a low impact movement and will mobilize her hips. Next, we have a split squat lunge. There will be a close kinetic chain exercise. She'll start with holding the TRX for support and then move to using a band. Next, we have the plank. We'll start with using a TRX as this is appropriate for MS patients, and then move to the full plank to target the trunk, which is critical for balance.
So our last exercises for these programs is the leg kickbacks and bird dogs. So these two exercises strengthen the glutes and core musculature, and they also challenge balance in the quadruped position. This is really good for patients with MS specifically because they have a high fall risk, and this will prevent a fall risk for them as well because standing and doing a kickback might not be very appropriate for her. So if we're already closer to the ground and having her in that quadruped position, if she falls and she's just falling on the ground from a couple inches above the ground. The last exercises that we selected were a plantar flexion with a band and calf raises, which these improve gait and balance, strengthen the ankle musculature, and they also prevent drop foot and they reduce her fall risk.
So at the end of our exercise intervention, we will want to follow up with Krista to reassess her balance with the best test and the single leg stance test. It also might be beneficial to include a gait assessment as well. And then we want to reassess lower body strength with the sit to stand test. We'll progress to single leg exercises, as mentioned in the Training the Older Adult blueprint, and add more load bearing exercises because we do want to train across the force velocity curve in order to prevent the development of sarcopenia and osteoporosis, which are common in MS patients. We'll continue exercising in the morning to reduce fatigue and exercising 2 to 3 times per week. And we want to ensure proper hydration. So with the TRX progression, we'll have greater variability. In addition, with the dumbbells and the TRX, this will indirectly help with grip strength as she's holding on to these pieces of equipment with her fingers. And with the carry, it will also, more carries will help with improving gait. Um, and then additional strategies that she can implement in addition to our exercise program is doing aerobic exercise 3 times per week at a higher intensity, such as brisk walking. Like walking her dog might not be enough. She can get a smartwatch and track her mileage or steps, as well as doing flexibility training every single day. This can look like doing yoga and stretches. So here is our reference slide and our author contribution statement. Thank you for listening to our presentation.